Welcome to the deep dive. Let's jump right in. You might think ticks and Lyme disease, well, that's only a worry if you're hiking way out in the wilderness, right?
Yeah, that's a common thought.
Well, here's a surprising fact right off the bat from the sources we've been looking at. Ticks that carry the bacteria for Lyme disease. They can be found right in urban gardens, parks, too, across the UK.
Absolutely. They're these tiny sort of spider-like creatures. They don't jump or fly, but they are incredibly common in grassy and wooded areas.
Places you might not expect.
Exactly, like your local park sometimes. They just need, well, something or someone to brush past them and they latch on.
And that really changes how you think about exposure, doesn't it?
It does.
Which is exactly why we're doing this deep dive into Lyme disease today. It's a topic that, well, it can affect anyone who spends time outdoors, whether you're up in the Scottish Highlands or just, playing with the dog in the garden.
That's right. And we've gathered quite a few sources for this. We've got info from Community Pharmacy England, the NHS, and the detailed clinical guidance from NICE. That's the National Institute for Health and Care Excellence.
So our mission here is to cut through the noise, pull out the essential knowledge from these expert sources, and give you a really clear picture. What Lyme disease is, how to, well, reduce your risks significantly, what signs to look for, and what happens if you actually get diagnosed.
Think of it as your shortcut to understanding Lyme disease, straight from those key sources.
Okay, so let's start with the absolute basics laid out in the sources.
Yeah.
At its heart, Lyme disease is a bacterial infection.
Correct. And the crucial detail is that it's spread to humans specifically through the bite of an infected tick. That's important. Not all ticks carry the bacteria.
Thankfully. And where are these ticks?
Yes, I
Is
missed
that
that.
not just the wilderness?
No. The sources point to grassy areas, woods, and those urban parks and gardens across the UK.
And some areas are higher risk.
Yes, places like southern and northern England, the Scottish Highlands are often mentioned, but they're also found in many other parts of the world across Europe, parts of Asia, the US, Canada. They're quite widespread.
And how do they actually get onto us?
Well, they attach to the skin as we, or animals, brush past vegetation. They feed on blood for a few days and then they just drop off.
And a really key point from the sources is this. Tick bites aren't always painful.
You might not even know you've been bitten unless you physically see the tick on you.
Which is a bit unsettling. But to put it in perspective, and this is another important reassurance from the sources, most tick bites do not transmit Lyme disease.
That's a crucial point. Even if you are bitten, the chance of actually getting ill is relatively low.
Okay, so that brings us to prevention. Knowing where they are is step one.
Step 2 is minimizing the bites. The advice from the sources is pretty straightforward, really. Cover exposed skin when you're outdoors, especially in those grassy or wooded spots.
Tucking trousers into socks. The classic.
It works. And using insect repellent is strongly recommended. The sources specifically mention that repellents with DT seem to be the most effective against ticks.
Staying on clear paths helps too, right? Avoid brushing against tall grass.
Exactly. And wearing light-colored clothing can actually make it easier to spot a tick if one does get on you, before it bites.
Good tip. And then, after being outdoors, particularly in those higher risk places, long grass, woods, parks, gardens.
You need to check. Check yourself, check your children, check your pets. Thoroughly. Look closely at skin and clothes.
Now, what if you do find one? Safe removal is critical here. The sources are really clear on this.
Absolutely. Don't just grab it and yank. And definitely don't try things like burning it off or smothering it in Vaseline.
So what do you do?
Use fine-tip tweezers or one of those special tick removal tools you can get from pharmacies or vets.
Okay, tweezers or a tool, then what?
You need to grasp the tick as close to the skin surface as possible, trying to get hold of its head or mouth parts, not its swollen body.
Right near the skin.
Yes. And then pull slowly and steadily upwards, straight out. The key thing is not to squeeze or crush the tick's body.
Why is that so important?
Because squeezing it could potentially push bacteria from the tick's gut into the bite wound.
Ah, okay. So slow, steady, upward pull. Got it. Once it's out.
Dispose of the tick safely. Maybe fold it in sticky tape or flush it. Then clean the bite area well with antiseptic or just soap and water.
That methodical approach sounds vital.
It is. And again, just to reassure, unless you notice a specific rash developing around the bite or you start feeling generally unwell, the sources say you don't need to do anything further after removing the tick.
The chance of getting ill from that single bite is still low.
Exactly.
Okay, so how do you know if you've actually been infected? This next part from the sources, recognizing signs and symptoms, this is where it gets really interesting, because it's not always obvious, is it?
No, it's not. The most well-known early symptom is that rash erythema migrans, often called the bullseye rash.
The bullseye, right?
Yes, and this rash is a real hallmark of Lyme disease. The sources stress how important it is. It typically appears around the site of a tick bite.
When does it show up?
Usually 1 to 4 weeks later, but the timing can vary a lot. It could be as early as 3 days, or sometimes it might take up to 3 months to appear.
3 months.
Mm.
Wow. And what's it like? Because the sources make a point about what it isn't like.
That's right. It's usually not hot, itchy, or painful, which is very different from a normal insect bite reaction that flares up and goes down quickly.
So does it feel like a typical bite reaction?
No, it's more like a spreading redness. It starts small and expands outwards over days or weeks. It forms a circular or oval shape. It might have a clearer area in the middle, giving that classic bullseye look.
But not always.
Often it doesn't. It can just be a solid patch of redness that gets bigger. It can be flat or sometimes slightly raised.
And this is a really crucial insight from the sources. How it looks depends a lot on your skin tone.
Hugely important. On white skin, it might be pink, red, or even purplish. But on brown or black skin, it can be much harder to see. It might look more like a bruise or just a sort of expanding area of discoloration.
So you really need to look for changes in color or texture that are spreading out over time, not just assume it will be a bright red ring.
Precisely. The sources contrast this EM rash with a typical non-Lyme reaction to a bite, which is usually just a small itchy bump that appears quickly and goes away within, say, 48 hours. That's generally just an inflammatory reaction.
Okay. What about other symptoms apart from the rash?
Well, some people develop flu-like symptoms. This can happen days or weeks after bite, and sometimes they get these without ever noticing or having a rash.
So like a summer flu.
Kind of. The sources list things like a high temperature, maybe feeling shivery, headache, muscle and joint pain, and just feeling really tired, lacking energy.
And the guidance also mentions looking out for Lyme if someone has several less specific symptoms together.
Yes, things like fever, sweats, swollen glands, feeling generally unwell, malaise, that profound fatigue, maybe neck stiffness, joint or muscle aches that seem to move around the body.
Migratory, they call it.
That's the term. Also, cognitive issues like difficulty concentrating, that brain fog people talk about, headache, or even pins and needles.
So quite a range.
Yeah.
What happens if those early signs are missed, or maybe treatment gets delayed?
This is where the sources warn that more severe symptoms can develop, potentially months or even years later, as the infection spreads through the body.
Okay, what kind of things are we talking about then?
Well, the bacteria can start to affect other systems. You might get significant pain and swelling in the joints, particularly large joints like the knees, Lyme arthritis.
Nerve problems too.
Yes, nerve problems like facial palsy, that's weakness on one side of the face. Other nerve issues too, sometimes meningitis, or rarely things like encephalitis, which is inflammation of the brain. Even neuropsychiatric problems or visible changes on brain scans in some cases.
Wow, that's serious.
It can be. There can also be effects on the heart, like heart block, where the electrical signals are disrupted, or pericarditis, inflammation around the heart, eye problems like uveitis, and certain persistent skin conditions, too.
It's really striking how varied those later symptoms can be.
It really is. And one final, very important point the sources make here. You can have symptoms of Lyme disease without ever remembering being bitten by a tick.
Right, because the bite isn't always noticeable.
Exactly. However, the guidance is absolutely clear. Lyme disease is not diagnosed in people who don't have any symptoms at all, even if they know for sure they've had a tick bite. You need the symptoms.
That distinction makes sense, and it leads us neatly into how it's actually diagnosed. It relies on clinical judgment and sometimes lab tests.
Correct. The first step is always a clinical assessment. The doctor looks at your symptoms, asks about your activities, have you been in tick areas, do you remember a bite, that kind of thing.
And that erythema migrans rash we talked about, that's really significant here, isn't it?
Hugely significant. The NICE guidance is very specific. If that characteristic expanding rash is present, Lyme disease is diagnosed clinically, and treatment should start without waiting for lab tests.
So see the rash, start the treatment promptly.
Yes, that prompt treatment is seen as crucial for preventing those later, more severe complications.
Okay, but what if there isn't a rash, but you have other symptoms that make the doctor suspect Lyme? Flu-like feelings, joint pain, etc.
That's when diagnosis gets a bit more complex. It relies on a combination of that clinical picture and laboratory testing. This is where the two-tier testing system comes in, as outlined in the sources.
2 tiers. Okay, how does that work?
So if Lyme is suspected but there's no EM rash, they start with an initial blood test called an ELISA. Ideally, the sources mention using newer ELISA tests that are more specific, like those looking for antibodies to particular Lyme proteins like VLSC or C6.
Right. And what happens after that first test?
If that initial ELISA test comes back positive or maybe equivocal, which means sort of borderline or unclear.
Then they do a second test?
Exactly. They follow up with a confirmatory test called an immunoblot, sometimes called a Western blot. This second test is more specific and helps to rule out false positives from the first screening test.
Okay. What if that first ELISA test is negative, but the doctor still really thinks it could be Lyme based on the symptoms and history?
Good question. The guidance suggests reviewing the timing. If the first test was done very early, say within 4 weeks of symptoms starting, it might be too soon for antibodies to show up reliably.
So they might repeat it.
They might repeat the ELISA test 4 to 6 weeks later. However, if symptoms have actually been going on for 12 weeks or more, they might skip repeating the ELISA and go straight to the more specific immunoblot test.
I see. And the diagnosis is confirmed if.
If you have symptoms consistent with Lyme disease and the immunoblot test comes back positive.
What if the immunoblot is negative, though? Even if the first test was positive?
If the immunoblot is negative, regardless of the initial ELISA result, but your symptoms are still there and causing problems, the recommendation is generally to consult or refer to a specialist.
Like an infectious disease doctor.
Or a rheumatologist or neurologist, depending on the main symptoms. They can consider other specific tests, maybe on joint fluid or spinal fluid if relevant, or, importantly, investigate other possible diagnoses that could be causing the symptoms.
Right. It might not be Lyme after all.
Exactly. And if the tests are negative and your symptoms actually get better or disappear on their own, the sources say no treatment for Lyme is needed.
It's also really vital to understand that these tests aren't perfect, as the sources point out.
Absolutely. No lab test is 100%. False positives can happen, and so can false negatives. Antibody tests might be negative if done too early, as we said, before your body has had time to produce enough antibodies.
Or if someone's immune system isn't working properly.
That too. They might not mount a strong antibody response. The NICE guidance also adds a specific warning about using tests from labs that aren't accredited by the UK's national accreditation body, saying their reliability might be questionable.
Which underlines why clinical judgment is still so important.
Massively important. The sources really emphasize that Lyme disease should not be ruled out just because the tests are negative, especially if there's a high clinical suspicion based on the symptoms and the person's history.
But equally,
They caution against diagnosing Lyme disease without either supportive symptoms and history or positive tests, because you risk missing other conditions that might need different treatment.
it's a balance. And doctors should explain these limitations to patients.
Yes, communication is key. Explaining the test limitations and the fact that many symptoms like fatigue or joint pain can overlap with lots of other conditions.
Okay, so let's say Lyme disease is diagnosed either by the rash or through testing.
Mm.
How is it managed according to these sources?
The mainstay of treatment is antibiotics. If Lyme disease is diagnosed, a course of antibiotics should be prescribed promptly.
And how long is the course?
The duration is quite specific, and it depends on the symptoms. The sources outline different lengths, for example, typically 21 days for that early EM rash, or if there are neurological symptoms like facial palsy. But it might be a longer course, say 28 days, for things like Lyme arthritis or that skin condition, equidermatitis.
And it's important to finish the whole course.
Absolutely critical. The sources stress you must complete the entire course of antibiotics, even if you start feeling better quite quickly.
What kind of antibiotics are typically used?
The main ones mentioned are doxycycline, amoxicillin, azithromycin, and sometimes ceftriaxone.
Are there preferences?
Generally, yes. Doxycycline is often the first choice for adults and older children. Amoxicillin is frequently used for younger children or sometimes during pregnancy. Azithromycin is an alternative, but the sources highlight a specific caution. It shouldn't be used in people with certain heart rhythm issues because it can affect something called the QT interval.
And ceftriaxone.
That's usually given intravenously, so often reserved for more severe cases, or infections affecting the central nervous system.
The guidance even goes into detail about specific age cutoffs and weight considerations for dosing kids, doesn't it?
Yes, it does. And it notes that doxycycline can sometimes be used off-label in children under 12 for more serious infections based on specialist clinical judgment. despite historical concerns about teeth staining, which are now considered less problematic with short courses.
Is there anything else people should be aware of when starting treatment?
Well, something that can happen, though not to everyone, is called a Jerisch-Herxheimer reaction.
Okay, what's that?
It's a temporary worsening of symptoms like fever, chills, muscle pain, headache that can occur quite early in the antibiotic treatment, maybe in the first 24 hours. It's thought to be caused by the release of toxins as the bacteria are killed off rapidly.
Sounds unpleasant. Does it mean you stop the antibiotics?
Usually not. The sources reassure that while it can be uncomfortable, it doesn't typically mean the treatment isn't working or needs to be stopped. But you should definitely contact your doctor if it happens.
And doctors might schedule a follow-up.
Yes, a clinical review during or after treatment might be needed just to check for any side effects and see how well the treatment is working.
Right. Now, perhaps the most challenging area the sources discuss is what happens when symptoms continue after treatment.
Yes, this is a really crucial and often difficult aspect. The sources acknowledge that while most people do recover fully after antibiotics, full recovery can sometimes take months. Symptoms might improve quite gradually over time.
But sometimes they don't fully resolve.
Unfortunately, yes. The reality acknowledged by the sources is that some people continue to experience significant symptoms like profound tiredness, widespread aches, and just a lack of energy for extended periods, sometimes even years after completing their antibiotic course.
What kind of conditions do these symptoms resemble?
They can look quite similar to conditions like fibromyalgia or chronic fatigue syndrome, MME. And importantly, the sources state that the exact cause of these specific ongoing symptoms after Lyme treatment isn't fully understood.
And there's no standard treatment just for those lingering symptoms.
Not a universally agreed one, no. It's a complex clinical situation.
So if symptoms don't improve, or they persist, or maybe even get worse after someone finishes their antibiotics, what do the sources recommend?
They recommend a really careful review of the person's whole history and situation. The key questions doctors need to ask are, could these ongoing symptoms actually be caused by something else entirely, something unrelated to Lyme?
An alternative diagnosis.
Exactly. Or could the person have been reinfected by another tick bite since their treatment? Is it possible the initial antibiotic treatment didn't fully work treatment failure? Or are the symptoms perhaps the result of permanent damage caused by the initial infection even though the bacteria are gone?
That's a lot to consider. How does that review guide further treatment?
It's approached cautiously. If reinfection is strongly suspected based on the history, maybe they had another definite tick bite and developed a new rash.
Then another course of antibiotics.
Yes, in that specific scenario, another appropriate course of antibiotics would be offered.
What about suspected treatment failure?
If treatment failure with the first course is genuinely suspected, the guidance says a second course of antibiotics may be considered, ideally using a different type of antibiotic than the first time.
But only a second course.
This is a critical point from the NICE guidance, really aimed at preventing potentially harmful long-term or repeated antibiotic use without clear benefit. It states, do not routinely offer more antibiotics if symptoms persist after someone has already had 2 completed appropriate courses.
So no third or fourth courses just for persistent symptoms.
Not routinely, no. At that point, the strong recommendation is to discuss the case with a national reference laboratory or to consult with a specialist, infectious diseases, rheumatology, neurology, to thoroughly explore other potential causes for the ongoing symptoms.
And again, communication with the patient is key here.
Absolutely vital.
Yeah.
The sources advise explaining that ongoing symptoms after treatment might not mean the active infection is still present. Recovery can just be very slow for some people.
And there's no test for active infection afterwards.
Correct. They note there's currently no reliable test to prove active infection is still there after treatment, and it needs to be clearly communicated that an alternative diagnosis might ultimately be the explanation for the lingering symptoms. It's a really tough situation for people experiencing this.
It sounds incredibly frustrating. You don't want to keep giving antibiotics if the infection's gone, but you desperately want to know why you still feel unwell.
Precisely. It highlights the complexity of post-infection recovery.
This leads us to a few specific situations the sources mention. What about pregnancy?
Yes. If a woman is diagnosed with Lyme disease while pregnant, she gets treated with antibiotics, but specifically ones known to be safe during pregnancy, like amoxicillin.
And the risk to the baby.
The sources offer reassurance that transmission from mother to baby is considered unlikely, but completing the treatment course is obviously very important for the mother's health.
Should she mention it to her midwife or doctor?
Definitely. She should mention her history if she has concerns about the baby. That might prompt discussion with a pediatric infectious disease specialist. Sometimes babies born to mothers treated for Lyme might receive specialist care or monitoring, especially if they have certain antibodies or if there's any suspicion they could be infected.
Okay. And what about getting Lyme disease again? Reinfection.
That's another key point. Having Lyme disease once does not give you lifelong immunity. The sources confirm it's entirely possible to get infected again if you're unlucky enough to be bitten by a different infected tick later on.
So prevention is still important even if you've had it before.
Absolutely. Keep taking precautions.
And briefly, the sources also touch on emergency situations.
Yes, just a reminder that if someone develops severe acute symptoms like signs of central nervous system infection or severe heart block, even if Lyme disease is suspected as the cause, it requires immediate emergency assessment and management according to standard medical protocols. You don't delay emergency care.
Makes sense. And a note about children.
Yes, for children and young people under 18, the management of Lyme disease, unless it's just a straightforward, uncomplicated EM rash, should generally involve discussion with a specialist.
Like a pediatrician.
Or a pediatric infectious disease specialist, or neurologist. This is mainly because some presentations, like Lyme arthritis or facial palsy, are less common in children, so expert input is valuable to confirm the diagnosis and guide management.
Okay, we've journeyed from that tiny tick bite through symptoms, diagnosis, treatment, and these complex ongoing issues. But despite all this detailed guidance from sources like NICE and the NHS, they also openly acknowledge areas where more research is still needed, right? Especially for the UK.
That's right. The NICE guidance in particular lists several key research priorities. They really want a better understanding of how common Lyme disease actually is in the UK, the true incidence.
And how it typically presents here.
Exactly. How it presents, how current management strategies are working, and what the long-term outcomes are for patients specifically in the UK healthcare system.
They also want to know how common Lyme antibodies are in the general UK population who don't have symptoms.
Yes, what's called seroprevalence. Knowing that baseline level of exposure in the population helps doctors interpret test results more accurately when someone does have symptoms.
And more research into treatments and tests.
Definitely. They want research to pinpoint the most clinically effective and cost-effective antibiotic regimens for the different ways Lyme can manifest. And crucially, they're pushing for the development of better diagnostic tests.
Better tests for what, specifically?
Especially tests that could perhaps help identify later stages of the disease more reliably, or distinguish active infection from past infection, or help diagnose reinfection. Maybe using new types of markers, biomarkers.
It's a clear sign that while we have a solid knowledge base from these sources, the understanding is still evolving.
Absolutely. Science is always moving forward in this area.
So this deep dive has really shown us the importance of prevention. Those simple steps can make a difference.
And the nuances of recognizing symptoms, especially that EM rash, but also the less specific flu-like illness.
We've seen the structured approach to diagnosis, involving clinical judgment, and that two-tier testing system when needed.
And the antibiotic treatments that form the core of management, along with the complexities and challenges of those ongoing symptoms that some people experience after treatment.
I think key takeaways are definitely being aware that ticks aren't just in remote wilderness. Check yourself even after time in the garden or park.
And prompt, correct tick removal is important, although remembering most bites don't actually lead to Lyme disease.
That erythema migrans rash is a really clear signpost for immediate treatment without waiting for tests.
And that early antibiotic treatment generally leads to the best outcomes and offers the best chance of a full recovery.
But also, crucially, understanding that if symptoms do persist after treatment, it often doesn't mean the infection is still active, and it doesn't automatically mean more antibiotics are the answer.
Yes, recovery can be slow, and exploring other potential causes for those lingering symptoms becomes really important at that stage.
It really leaves us with a thought-provoking question, doesn't it? Drawn from the reality acknowledged in these sources. Given that recovery from Lyme disease can sometimes take months or even years for some people, and symptoms can persist long after the initial infection seems to be cleared, how does our current approach, our understanding perhaps, of infection, recovery, and persistent symptoms need to evolve to better support those who are living with these long-term effects?
That's a big question. What stands out most to you from this deep dive we've done today? Thinking about this information, what might you do differently next time you're enjoying the outdoors?
We hope this deep dive has given you a much clearer picture of Lyme disease, bringing together that essential knowledge straight from the experts so you can navigate potential tick exposure and its aftermath with, well, a bit more confidence.